Hey everyone, welcome to our panel. This is going to be a little more interactive than the last few. So before we get started, because I want some interaction from everybody who's attending, I want everyone to either stand up, you don't have to stand up, you might not, but at least wiggle a little bit, get the blood flowing, wake up. Okay, we all need dance classes. So to get us started here, instead of me telling you who other people are, I'm going to let them tell you who they are. So I'm going to go ahead and ask everyone to introduce themselves on the panel. We'll start from the far end.
Hello, everyone. I'm Erin Woody. I'm the Chief Operations Officer of Voices of Hope. We are a community-based organization. We operate in Cecil and in Harford County. Super excited to be here today.
Hey everybody, my name is Katie Carroll. I'm the Harm Reduction Program Coordinator at the Cecil County Health Department. I'm also a certified peer recovery specialist and a registered peer supervisor, and I'm also very excited to be here.
Hi guys, my name is Jason Beener. I'm wound care for Voices of Hope in both Hartford and Cecil, and more importantly, harm reduction and outreach.
I'm Jara Griffith, and I am Voices of Hope Cecil County Harm Reduction Supervisor.
I am Tracy Anderson. Can you guys hear me?
Yeah.
Yep.
I'm the Director of Community Health Services at Cecil County Health Department. I apologize I couldn't make it in person today.
Okay, so in just a couple of minutes here, I'm going to open up to questions from everybody else. Before we do that, I'd like us to get everyone to get a little background on the awesome partnerships that are going on in Cecil County. So I'm going to ask two questions. They're going to sound really similar, and we're going to learn a little bit about the creation of the partnership and what it looks like for both sides. So I'm going to start by asking our folks from Cecil County Health Department, can you tell us about how this partnership got started at the health department and a bit about the health department's role and responsibilities in this partnership?
I'll take that, obviously. So when I started working in harm reduction and doing capacity building for the health department, we had a very close relationship with Voices of Hope. The organization actually started within the health department, and then it branched off into its own 501c3. As a public health department worker, we realized that we needed more reach in the community. We needed more bandwidth to provide all of the services that we needed in the community for people in our rural area. It was hard to get people to come into the health department. So we needed to build relationships, which we already had established relationships within our stakeholders. The community-based organizations had that reach into the community with community members. So it was just a really harmonious extension and being able to offer services out in the community. And I think Erin can talk a little bit more about how Voices of Hope has branched out from that relationship and how we work together.
Yeah, so in the early days, with Voices of Hope, we were just a bunch of people. How we were created, we were just a bunch of people in recovery that came together and we're like, we have to do something in our community. Our community is suffering. And so with the help from the Cecil County Health Department, they let us start meeting in their auditorium weekly, helped us in the beginning build our 501c3. And, from there, we started to build our, some of the first things we did together was we worked together on overdose survivor outreach, realized that the connection that we had out in the community, and then during the capacity building, the Cecil County Health Department, they did a lot of work, a lot of groundwork, capacity building on their harm reduction program. And they pulled us in. In the beginning, they knew that, we started our backpack outreach out in the community. So we had peers that actually put on backpacks, went out into some of the communities in Cecil County that were most affected by overdose. And we were just walking around telling people, who we are, what we had to offer to them. And when Cecil County got approved for their syringe services, we were already building relationships in the community. So we had that connection and we partnered from there with the health department with their support, and since then, we've partnered with them on several other things in the community. We have crisis services, our catch hotline. So we're able in Cecil County, in conjunction with the health department, we are able to offer 24 access to peer recovery specialists, treatment coordination, and just any time of the day or night, pick up the phone, get a hold of someone, and access our services.
Perfect. That was the next question. So, no, unless I have to talk about it for everyone. Just want to ask before we move on and open it up to questions, if anybody else had anything to say in terms of, what the program does, how it got started, what the, roles and stuff like that. Okay. Any questions yet from online in here? Who's got some questions? Go ahead and start asking. If not, I got some up here, but Zach.
So what kinds of services around, like the topic today, we're focusing on HIV, STIs, infectious disease. What kind of stuff was Voices of Hope able to do, and or the health department able to do to expand the reach of both of their services by partnering around those things, like HIV, hepatitis C, STIs, testing, immunizations? Is there any of that kind of stuff that was part of the partnership?
So before, the peers that work within Harmony were trained to be able to do rapid testing and confirmatory blood draws. We utilize the community health service nurses in the clinic at the health department to be able to do the testing, to do the confirmatories, and to also refer to providers in the community, providing that linkage to care. We have HIV case managers that can do a lot of services like transportation for appointments, pay for prescriptions, really do wraparound services with people that are being tested and referred to care. And as peers, and all the people that work in Harmony, our peers, people in recovery, people with lived experience, we are resource brokers. That is something, especially in rural healthcare setting, like we have to learn how to do innovative practices and figure out how to do these things. So myself and another peer that works within the program, as well as some of the Voices of Hope peers, were then trained to do rapid testing out in the community so that we could make it as low barrier access as possible. So we're able to do rapid testing out in the field. We can set up, as long as we're able to be in an environment where we can do controls and make sure it's, an adequate setting for that. I've done it in the back of a van, in people's homes, doing confirmatory blood draws in backs of vans, or trying to, just being able to follow that person all the way from the fear of being tested to getting results, to then helping them access the care that they need if any positives were to come back, is really important. Like, peer work is all based on the relationships that we build with people. So it's really important to be able to make it low barrier, easy to access for people who use drugs. And I think one thing that the Harmony program did really well was mobilize all the services within the health department, because it's rural public health. Like, we have to go out where people are, out in the community. So that's something that we were able to do and then extend through Voices of Hope. And I don't know if Tracy wants to take on the community health nurses.
Sure. We purchased a van actually out of some extra funding and a grant that we had, so that we could actually start to try to meet people where they're at and team up with Katie's team. I do have a nurse in the prep program, as well as a community health outreach worker, and they go out and team up with Katie's group, and they will do testing as well in the community and outreach. So we're doing the best we can to meet people where they're at. However, the van was purchased. We did not get authorization to do testing, the urinalysis. So we can still do the rapid HIV and Hep C, which is huge, and link them to care. We also have the HIV case manager on speed dial from the van, but we do try to bring them in for actual exams and testing that way. But Katie, you nailed it. So thanks.
Yeah, and I think just to add, the uniqueness that Voices of Hope brings in partnership with the health department is we serve a different population. There is a certain population that will, some people, might seek out recovery. And when they get into recovery, they're like, I need to go get tested. One of the first things we do when we get into recovery sometimes is I need to go and get tested. And they seek out, the health department. And then, Voices of Hope, we have the ability to serve a different population. Through our outreach, we're serving a population, and with our harm reduction team, a population of individuals who are not connected to any services whatsoever. They're in pre-contemplation stage of change. They're not even thinking about their health, their wellness, getting tested, or even that they should get tested, or even that their behaviors are high-risk behaviors. And through the relationships that, a community-based organization builds by being out in the community, by going on walks, and not being affiliated with a state department sometimes, because sometimes, we know people will be like, I'm not going there. Someone will tell social services or someone else on me. The relationship that we're able to build with people, they trust us. So then it's easier for us to link them to care, to, Katie, her team, the health department, we're able to call them out. There's been times where I can call and I say, look, I got a participant and they're ready to get tested right here, right now. And, Katie's team in the health department will come right out if it's feasible, or get it scheduled, and we know where to find the person, whether they have a phone, they don't have a phone. Our teams are so connected that we're able to find the individual. Katie, we meet weekly. We are very collaborative in all we do. And, if we'll bring up something, and if they're not able to find someone, they're like, I need you to keep an eye out on this. And I know, Jara and Jason down here, they do a lot of the street outreach. I'm stuck behind the computer. But 9 times out of 10, them or their team will be like, oh yeah, Katie, I know where they're at. They're here at this day, this time. We do have a sex worker population in Cecil County. Our harm reduction programs, both of our harm reduction programs, are very familiar with the sex working population, and they trust us, and we're just able to collaborate and just set up testing, linkages to care, any follow-up services that they need. And it's really wonderful.
I think we might have some questions online, but before we move on, I want to ask about something because it's come up a couple times. And I'd love to hear a little bit more about it. Prevention peers. As a peer myself, I like talking about the importance of peers, but I'd love to hear a little bit about retention in treatment, especially how peers play a role in helping keep people in treatment and aiding in that retention. So if anybody could talk about that, that would be fantastic.
As far as I'll speak up on it, because as a nurse, I'm one of the few people that work for Voice of Hope that aren't a peer. So I came in, Voices stole me from a hospital system, which I was very comfortable at. Doing wound care, I came actually out of cath lab, which was hard to steal me from. But there was a need, and this is the first time I was introduced to what a peer actually is. It's someone with lived experience, typically somebody that came out of addiction, is active in their recovery, and that means participating in active recovery, not just someone that stopped using drugs or alcohol. So I'm now ushered into this world where I'm alone, and I immediately saw the value in having someone safe, having someone with lived experience, and having someone relatable that understands what's going on, because people will check you. And this is, as a nurse, I knew this in the hospital system. People are like, you don't know anything about me. Like, you're not a lady, you don't have breast cancer. I don't. I know enough to take care of you, but I can't relate. Well, when you're standing in someone's motel room doing wound care or trying to get them the treatment or talking about hepatitis, I need to have that relatable person. Without that relatable person, I'm a goner, because they do check you, and they can be nodding out, trying to stand up and saying, you don't know anything about me, I don't want to talk to you. And it's happened. So in wound care, that's where I met Jara. And like, we go out as a team and pretty much tackle it all. And it's so important when you get someone in that pre-contemplation, contemplation, to not shower them with what I think most medical systems kind of do with, you need treatment, you need X, Y, and Z. It's to really ease them into it, because they come out of a world of pure chaos, and having someone that lived that can be like, Jay, back off a little bit, Jay, you know, like push forward. Or I like kind of lean into whatever she does. Like I follow her lead when it comes to people, and I've thrown people in the back of my car and we take them to go get treatment. We take them to go get tested. We hunt down the sex workers. We keep an eye on the population in Cecil County. And it's the relatability of this and the relatability that I think we can provide, and say, oh, you know, I know someone at the health department that'll treat you right. I know somebody, let me call somebody. And that trust that we garner, we can share. And most people already know Cecil County is a large county, but it's a small community. Everybody knows everybody, but it's spaced out by 15 to 20 miles. And being able to say, I trust the people in the health department, they're not going to treat you bad. They're not going to be mean. They're not like everybody else. Let me make a phone call and I'll get someone there for you. Like that's what I think the peer part is. Because I know I can call a peer and they're like, look, like this is where they're at. And like, I get it. Bring them in, or set up a time, or I'll meet you at Voices. So that to me is like, the value of a peer is amazing. This is the best thing since sliced bread, in my opinion.
I'll also say that peer work is an evidence-based practice. There's credentials, there's a credentialing system, there's a lot of training that goes into it. And really important, there's a science to it, and there's also an art. So we learn trauma-informed care. We learn about the stages of change. So we learn motivational interviewing techniques to try and talk to people. And then the art of it is like implementing it and then using our lived experience to then help guide someone in their journey towards like optimizing their wellness, whether they're on that spectrum of use in abstinence or chaotic use, or they're not stably housed. Like we're trying to help people. They're in like this mode of survival. So we're kind of a voice for them. We help advocate for people and just give them all the options that are available to them to help them help guide them through whatever it is they're going through. Peers have been around for a really long time. There's research that shows a person that is engaged in harm reduction or with a peer program is 5 times more likely to enter treatment. And just some numbers, in the last quarter for Harmony program, we served 420 unique individuals. That's 420 people that probably didn't have any type of contact or access to care without accessing Harmony and the services that we have to offer. And then we had 712 encounters with those individuals. That's almost double. So they're seeing us more than once, which means if they're seeing me more than once and I say every time like, hey, we have this available, they're more likely to take advantage of those services that we're able to offer. So if I see dude every time, I'm like, yo, you want to get tested? I know you're scared. We can get through this. You know, having that lived experience of fearing what the test results could be or what I done to myself, even though I'm in recovery now, like there's a lot to it. So it's really important to have someone that does have that lived experience to engage them in services and continue in services. So.
And I think back to your question with retention and treatment, that's one of the things that we do partner with Cecil County Health Department on is our CATCH, it's Cecil Addiction Treatment Coordination Hotline. And we get a lot of people into treatment, but it doesn't stop there. So we actually make those calls, those follow-up calls into the treatment centers. And we're like, we sent someone there a week ago. Can we talk to them? Or when individuals are in treatment and after a couple days, they start getting a clear head and they start panicking, there's just a value in being able to call the peer that got you into treatment and freak out on the phone and say, I just want to leave. I need to leave. And being able to talk to them and say, I know how you're feeling. I wanted to too, but here I am 6 years later because I stayed. And this is what my life looks like. You can do it. You can get through it. And that hope, I think that it's such a huge help.
I think there might be some questions from online.
Yeah, someone asked, how do you find your clients?
Yeah, so I mean, that's to be a jerk on the street. To really answer the question, we're in the community. So like for wound care, we meet with people 2-3 times a week, 4 times a week, whatever's necessary, and along with harm reduction, and that gets us into motel rooms, hotel rooms, tent villages, exactly where they are. It's harm reduction 101. It's meet them where they are and produce the lowest barrier care you can. So in Cecil County, like I said, it's a weird county. It's north of the Susquehanna, so there's not a lot of resources. It bumps up against 2 other states. It has part of the Eastern Shore on it. It's so spaced out and it's so easy to be forgotten about. There's so many seldom seen folks that live in Cecil County, but we're there. That's the whole community part. Going out with a backpack on our back and being consistent, reliable, and participating in caring about someone that no one cares about, like word gets around quick.
Yeah.
Some do, some don't. We find them. A lot of times we're seeing one person. There might be 6 people in a motel room. We know one and they see that we're providing wound care for them, and someone else is like, I got an abscess, or hey, I don't know what your services are. What do you guys do? A gentleman walked in a room we were in the other day, kind of surprising to us, and backed out, not knowing who we were. And then we explained, like, we're harm reduction. Like, you know, this is what we do. We're a syringe service provider. We provide wound care. And he felt comfortable and closed the door. And that was our initial interaction with him. So.
And as it ties into the health department, the peers at the health department are enmeshed in many different community programs. So they go into the detention center, they go into the hospital. We're also very involved in overdose survivor outreach. So we're able to utilize those stakeholders to find those individuals that are participating in high-risk behaviors that might have more of an instance of hepatitis C, HIV, STIs. Also, the community health clinic we refer to a lot, as well as joining Voices of Hope or us for outreach events to be able to do testing. But it's more of us going out and trying to find folks, because there's still a big, and especially in a rural county, like they have that unique, beautiful landscape, but it's very hard to navigate if you don't have the resources. So that's something that Voices and the health department has been able to do, is mobilize all those resources in the community.
So for Voices of Hope, I know that being a peer and the biggest resource I have is, like, I used drugs in Cecil County. So like I know these people. And it, you know, as a peer, we learn that motivational interviewing, which is like I am able to get the information from you that I need to help our people. And that's what I do. Sometimes we work with like EMS or people like that. And I mean, they give us a name, and 9 times out of 10, I will find them, or I know someone who knows them, know where they hang out if they're homeless. Yeah.
If you rewind the clock 4 years, what it looked like in the beginning is Katie and I sitting down at a table together, taking all this information that the health department had access to, the overdose survivors, where the overdoses are happening, the fatals, the non-fatals. And we're just like, okay, we're going to go on a walk. And we got peers together and started walking in neighborhoods and going up to complete strangers and just introducing ourselves. That's what it looked like 4 years ago.
It's not much different now, other than it's pure chaos what we're walking into, but we're doing the same thing. We're meeting people and just introducing ourselves. But our bag of tricks is different than the bag of tricks you carry with you then. So.
Any other questions? Okay, well, I'll ask a few more, see if that brings any questions up in the audience. So this one I just wrote down as everyone was talking. And so, as everybody heard, I work for the health department, and something that was being talked about was that trust between the health department and Voices of Hope, and building that trust and how that really increases what you're able to do. So we got a lot of people here who work for the health department, work for private provider. How do we build that trust with you? What makes you want to trust us so that we can build those programs with a community organization who's deep in the community, especially if it's a community like people who use drugs who may be very used to discrimination, medical malpractice, things of that sort.
For me to trust somebody, it's like my original nursing career was in critical care. So if I was in a bad situation in a room and 3 of the nurses were solid and 1 wasn't, I'm just not going to ask that 1 that wasn't for help. I'm not going to give them a task. So I wouldn't reach out or utilize the resources if I didn't trust them. So I think trust is one of those things, like establishing trust. And that's probably going to be the hardest thing to navigate, because as people working in like government health, you guys have like a set standard and protocols and strong like rails you got to ride. And for me, it's knowing what I'm allowed to do and what like the health department's allowed to do, and not asking the health department to do something they're not allowed to do. And that relationship, and it's the same way. It's I don't know. To me, it's just trust and communication. Like it's finding the right people. It's really about hiring practices. To answer your question directly, hiring practices and trust and communication. That's what I think is the best thing. Hire the right people, build trust, and communicate, have open communication.
Yeah, it's taken time. It's time, patience, and it's definitely a flower that has to be watered daily. Building a relationship. I know, yeah, I know that a relationship like ours, it's built over time. I do know that it all stems from the same passion. We all want to help individuals, and through time, we have gone through instances where, the health department is able to see that, wow, Voices of Hope is allowed, I'll say allowed, to do things that the health department might not be allowed to do because of policies and procedures. And, through time and patience and, seeing the things that we're able to do, but also the health department, I mean, man, they come with so many things and resources that we don't have access to, that we can't tap into. So it is a two-way street. There is so much that, just through our relationship with the Cecil County Health Department, that we have benefited. Voices of Hope has benefited from the relationship. But I can also, I'm just going to assume that they would say the same thing, that there's things that they have been able to benefit from us. And, our funding is different. So sometimes, grant world, there's, go after the same grants. But we also have donations, and we have so many other funding streams that are not tied to anything, that we can buy that pair of boots without it having to go through 10 layers of red tape. Someone is able to call us and just be like, we don't know what to do this person. We need to just take them here. They need a bus ticket back to their hometown. And Voices of Hope can just say, okay, we'll do it, but then there's other things the health department can do for us with their funding, and some of their funding that they know they have, that it helps us at Voices of Hope too. So I think it's a two-way street. Time and patience.
I'll just say for the health department too, the thing I like most about harm reduction when I started working in it was a couple of the principles. It's participant-centered services, as well as pragmatism, like being able to look at something realistically and implement evidence-based strategies to address those gaps and stuff. So being able to recognize your role in the programs that you're offering in the community, and knowing that you have advantages, as well as all the other organizations that you're working with, your stakeholders have their unique advantages. And then the main thing is knowing that the person that the program's supposed to serve is most important. Having that voice at the table, or at least having an advocate for that voice at the table, is really important. And it's always been really easy for us. No, I can't say that. been very easy to see the success and how well we've worked together over the last couple years because we have the same goal in mind, and that's making a difference in our community and being able to help people and see people thrive in their status. So I think it's just really important to know, like, the health department has amazing infrastructure. Like, we're able to do a lot of things because we have really long-standing relationships with organizations and stakeholders in the community. But we also have to know that the health department can't do it all. We don't have the bandwidth. We don't have the time, especially services most of the time are business hours. This stuff doesn't stop when business hours aren't running. So it's knowing that we can count on people in the community to take responsibility for the community and try to make a difference in the problems that we're trying to address through program implementation and capacity building out in the community.
Tracy, we haven't heard from you too much from you. Did you want to add anything?
Actually, Katie nailed it. Other than there are more boots on the ground than we are. I'm sorry, let me see if I can get on here. There are more boots on the ground than we are, but we work in the background of the follow-up and the case management. And again, we are trying to get nurses to support Harmony and get out there with them. And they too are trying to employ a nurse that will be able to take care of wounds, because unfortunately, there's a big stigmatism in the community, and people are denying care that they really, really need. The wound care, I mean, it's bad when someone says, I'd rather lose my hand than go into the ER because of the way we're treated. So we are working on looking at different options to make sure that we have better outreach. But I think so far we've come leaps and bounds, and Katie was the pioneer with ADRC to get that going. And Voices of Hope is very good to us as well. I appreciate hearing how good we are to them, but it is really a good partnership. We do round out each other real well. And again, access to care is huge for us. We're working on being able to get more nurses out there. And we are really working on pairing healthcare providers like Jason that are open-minded and kind and serve because they love serving, and that they're not judgmental. So we don't want that reputation.
Got a question. We whittled. You gotta have some questions. Zach.
I have a question. So I think health departments, and this is probably true for most health departments across the United States, historically, like not the people working there now necessarily, but historically have not always done the greatest job of forging strong community partnerships and supporting people, right? So has the health department seen the partnership with the community-based organization as benefiting their image at all, or how the community views health department services via the community trusting Voices of Hope? Does that trust transfer to the health department because of your partnership?
I would say yes. Would you say the same, Voices of Hope? Do you guys see the same on your end as well?
So I think it's a united front. You know, we in Cecil County, we do partner on a lot of things, and we try to be as united as possible. We do have two active syringe service programs, two different programs, but if you ask anyone on the street, all they know is it as one program, not, oh, this is the health department. This is, even our law enforcement officers, they just know, I don't think they don't differentiate because we are united on so many levels. So, yeah.
For participants, I'll say that we definitely see an increase in trust and having people access services through us if they're referred from an outreach team or someone in the community, just because it's like street cred. It's people rely on the information that they get from those around them. So if someone's using drugs and they need to get a test, like they're scared to walk into a state building, which is when we were doing capacity development, I was trying to think of ways to decrease like people's mistrust, like, oh, the health department building is great because we can cloak why a person's coming in. Like they'll come in and go to reception in one area, but they're able to then access services through us. So if their cousin working the front desk sees them, they don't really know why they're there. So it was just that unique like struggle and challenge of the close-knit community that we work in. But it definitely translates. Like we have more people that will call and access us and say, we do participant surveys, and that's just to see like engagement with services. And a lot of responses come back that people hear about our program through Voices of Hope, and they feel more comfortable coming in because they have someone that they trust to refer to, and then we can refer out to everything that we have access to. So.
What's up, Rachel?
So here at Partnerhips come in 4 years, it's hopefully awesome. So these years that you're looking for improvement, or are there anything that still like frustrates or challenging now, or things you'd like to see it differently, or like kind of where things at now? Can you repeat the question?
Yeah, it's not gonna be word for word, you know, but Rachel was asking, 4 years off now, what are just some of the challenges that you see now that you're working to overcome? And frustrations, maybe? You might, yeah. Yeah, or things you might see a little bit differently.
COVID had a huge impact on our ability to provide other really vital resources from the health department. Our community health services were really dedicated and needed for that COVID front, with vaccinations and testing and everything. So it really limited our ability to be able to provide those services out in the community. It was really challenging, which is why we then tried to build up our workforce of people that could do those. We're fighting a bunch of epidemics all at the same time: overdose, hepatitis C, especially in our community. I believe chlamydia and TB are on the uprise in Cecil County as well. So, and also just, I can say for the health department in our division, it's very difficult to retain staff. Staffing shortages coupled with the pandemics. It's the work we do is very emotionally demanding, and having people in recovery have to maintain that, as well as like professional responsibility. And then we always want to help as many people as we can. It's a lot to balance and juggle. I know a lot of people, like a lot of the peers, read the overdose reports, and that's people that you went to school with, people that you cared about and loved, and it really takes its toll working in that environment. So I can just say that that's been probably the biggest struggle for us at the health department over the past couple years.
I just want to say from like my experience of meeting Voices of Hope when they first opened. So I was probably one of the first 150 participants that participated in receiving supplies from them. And they did treatment coordination for me in the place that Aaron was talking about. It was like an attic. There was like 4 chairs. There was no offices, just a bunch of people kind of wanting to help. There was like 3 treatment centers that they worked with at the time. I was able to get into one to going through that whole process of like why they appear so important. So they followed up with me after putting me in treatment. And then, going farther into it now, we kind of host some recovery-based meetings there, all different kinds of pathways to recovery. And I was able to get connected to the recovery community outside of Voices of Hope even, and they were able to give me that connection. And then the same, I volunteered, and then like here I am as the harm reduction supervisor. So that's really, and I feel like I have like 2.5 years clean. So dealing with them from that almost beginning has been an amazing ride.
I think any business, like looking at like a community-based organization as a business, as well as a health department, because I wasn't a stranger to the the business side of a hospital. I think there are some growing pains and things that could do better, but I don't think they're anything like the other world, like the institutional medicine and hospitals have with each other. I think the need is so great that we kind of grow with each other. So I think it's like neck and neck. If we're not doing something that doesn't jibe right, it's kind of like they move up and we're just kind of back and forth with stuff. So my experiences have been fantastic. I'm sure on the back end there's stuff, but like for me, I couldn't ask for anything more because everything I asked for is met.
Yeah, I don't think any relationship is perfect, because if anyone said any relationship's perfect, they're lying. In any kind of any relationship. And you know, I think what makes it work is the communication, the open communication, the deep down passion that we all have. I know there's frustrations on the health department side with us. They're probably looking at us like, oh, you guys can't do that because we're the rebels sometimes. And I know us sometimes we'll look at the health department and be like, oh, why can't you do that? And but we communicate, and then we just have this understanding, and we grow through, we go through these processes and we grow through them. And we really complement each other and are able to communicate and get through. And I think that, you know, that's why, you know, just the past 4 years, we partner on so many different things. And, you know, I think that, you know, the future too, it's just, it's been a lot of groundwork and to get us here, and it definitely works.
I think Tracy was going to say something.
I just have a basic comment, and that is that I don't think peers make enough for what they do.
I was going to say the same thing.
I don't want to upset any administrators in there because I sit in that, but I just feel like they're so important, and they can go to McDonald's and make more money, and yet their job is so important. So that's all.
I agree with you, Tracy. So my experience, what I was saying earlier, it's like a paramedical position that has social work folded in. They have a certification process. They have all these clinical hours they have to do, and then they get paid far less than McDonald's does. It's a shame. I know for our end of the business end of peers, I know that our people are trying to pay them more. But like I said before, I'm feet on the ground. I don't know how that goes. I don't know how that works. But to raise the bar, I think it needs to happen across the board.
I agree. I don't know how to do that, but I would love to learn. I'm sorry, Katie. This is what's hard about virtual. You can't interact well. So I just feel like I don't know how to be the ambassador, but I speak to it as often as I can. You go in difficult situations all hours of the night. Your experience, you're sharing very personal experiences that I personally probably wouldn't share with strangers. And so I just think that we need to look at things differently. Just saying.
Oh.
So just continuing the conversation about peers, what are some ways that voices in the health department are, I guess, building the capacity of the peer workforce and empowering those peers once they're in the roles?
Oh, look at me. So I know Voices of Hope, you know, we offer this to anyone around Maryland. We are dedicated to building the peer workforce around Maryland. It's very needed. We offer curriculum. We offer a program. We receive funding from OWIF, it's the Opioid Workforce Innovative Fund, to fund individuals to obtain all of the hours in the role, the 25 hours, all the requirements to become a certified peer recovery specialist, the intern opportunities. So, you know, we're very dedicated in building the peer workforce. It's hard right now. Like Katie said, I mean, you know, the health departments, their hiring looks so much different than a community-based organization. It takes a long time. I feel for them, you know, being understaffed and not being able to just hire someone. Me personally, I can just be like, hey, Marcus, I like you, come in for an interview, and tomorrow he's getting paid, you know. We are floating around ideas with the health department right now about, you know, how we can just kind of help them get people hired and, you know, train some peers. get them hired under Voices of Hope until they can get through the process to be hired on by the health department. So there's neat strategic things that we're able to do and work together. So that's something that we're working on.
Sex entity with the Hartford County Health Department. I was just going to offer for anybody listening in who's working within the state of Maryland government that wants to hire peers. We figured out some ways to pay people better. If you want to talk about that, about how to pay peers better at your agency, feel free to reach out to me and we can show job descriptions and classifications and things like that to help figure it out.
That's awesome.
I saw some chat come up. It may not have been a question. No, come on, chat.
So the summer did ask and Tracy answered was that, do you all carry Narcan? And Tracy said, yes, we do. What are other tools that you have that you're able to use or have used at your disposal to help with any of the times that you see?
So I know for, I typically go out with Jason here, the wound care nurse. So we always have Narcan. One of us usually has a fanny pack with like already mostly open Narcan that we can just have because we go out into the community a lot. I know we talked about getting something that could break windows. We have talked about, you know, being able, we see people in cars all the time, just, you know, on the verge of an overdose. Besides Narcan, the great thing that he brings along is like all these great things that a nurse can offer that I can't offer, special wound care things. So I can get these individuals to talk about their wounds and then he's able to treat them. And that's how we build the trust up. Yeah.
Like I have a full car full of debauchery. Like I have Narcan, syringes, sharps containers, used and like clean, brand new ones. The trunk is full of wound care. Safe sex kits, which are condoms, dental dams, female condoms for like our sex work and populate anyone that asks for it. Really, it's not just sex work. And just about anything else we can cover, and resources too, like resource brokering in the community. So like those are all things in the bag of tricks we take with us. And to double back on what she said, like this combo between a nurse and peer, and this is something Tracy probably is starting to see too, it's potent. And I think there's something in the field work that is I'm feeling it and I don't know how to put it into words. If you team the right nurse up with the right peer, it's devastatingly positive. You can interject into conversations that you typically couldn't as a nurse. You're also training the peer to recognize things and do that early assessment. Like, hey, you know what? I was out this week. I saw someone's leg. It looked really infected. I don't trust other people to say that. If she told me that, I would, because she's been with me and we see that kind of thing often. And it's, as a nurse, like part of my job is teaching. It's just not a participant. It's anyone that listens. And I think that's another trick. Like the combo team, like if I had another nurse, it would suck. Like it would be horrible. Because there's always that nurse to nurse thing. And then you just kind of like back out of weirder situations. I know both of us will encourage ourselves to push ourselves to be better for the participant. Like she can say, okay, we can go in here, let's close the door. I would never close the door in a motel room. I trust her to say, close the door. Cause my wife and myself put a lot of trust in her decision-making prowess. Yeah, she makes sure I come home okay, and my wife gave her the thumbs up, so that's a huge deal for me. But I think that's the most important tool that we take out on top of the Narcan and all the other like physical things. It's that partnership, and it's like laser beam efficient if two people are trying to make somebody better.
Just a question. So I know you don't wound care. Like, what if they do require like antibiotics or cellulitis or anything like that? Do you have a practitioner that you work with?
I don't. So the majority of wounds that we're seeing, fortunately enough, don't. And even if we did have a practitioner, it would be I have a medical director that I can refer back to, but I really haven't. I was trained in wound care at Hopkins, and I still have infectious disease folks that are friends. I was trained up as a wound care nurse. Most wounds don't need it. if they do, like, I'm fully supporting going to a hospital and sitting with the person. Like, we'll throw them in the car and just take them, or we'll show up after they go through the process. Cecil County is a different kind of a bear up there. You have to go through metal detectors, get in the emergency room and stuff. So we can call in the back end and just have them tell us that that's a participant. And as long as the patient will say, like, you know, I work with them, we can go into almost like a social, like a social support group. And I can talk to teams. Like, I've done it in Delaware at a couple of the hospitals and stuff. But as far as like giving like antibiotics and stuff, no. But wound care is a lot of traditional stuff. It's about cleanliness, it's about hygiene, it's about entrusting the person with the wound to take care of it. A lot of it's just teaching personal hygiene, and my ability to double back on people. We have a few people, like there's the top 10 list of folks that I can just rattle off that I know I need to check back in with at least twice a week. And we do. We can lay eyes on them, we can see them on the street and just check in with them. And they are also well aware of their frailness. Like, you know, you could go south, you need to trust me. And that I've already started building that early on when I see them not taking care of themselves. And we've had some success with like meeting with the hospital and the wound care thing up there. But it's a lot of times, you know, the easiest resource, honestly, is tell them to head over to the health department for that kind of stuff. And for me, the follow-up after giving prescriptions would be so complicated because everybody sells their prescriptions. Don't kid yourself. They take 2 days of it. The minute the reg goes away, they're selling it to get drug money. And it's not uncommon for me to see people with scripts for everybody with every type of antibiotic under the sun, some antivirals, which is nerve-wracking to me. And if they tell me they're taking antibiotics, like I'm a nurse in harm reduction. Everybody knows what they're doing is wrong. I can sway people if they're not taking, like, if they're taking, you know, like broad spectrums and they really don't need it. If the wound smells terrible, like that kind of stuff, you can kind of sway. But I can't tell people straight up, like, you're going to kill yourself because, you know, they just had a needle arm 3 minutes ago. Like, we're beyond that kind of conversation. I wish we did. I mean, I wish there was a way to do it, but I think everybody overuses that magic bullet too.
I just wanted to comment on something, kind of like tie it back into STIs and testing and getting people access to care, like working in rural public health, especially. You have to identify your resources and utilize them. So we don't have the luxury of like a dense city like Baltimore City where we can just like, hey, you can just walk like next door and have this thing available. Especially a lot of our folks that have state insurance or suboptimal health insurance, there's only one infectious disease provider that we can refer to in our county, like locally. Like anybody else would have to go out of county for those services. And then that's a whole nother barrier to accessing care. So it's really difficult to not like tie everything together and work together as a team and being able to provide these services to people. So
I know we used Hopkins outreach before for like Hep C stuff. Like they've come up, tested and gotten people treatment and all virtually kind of stuff. Just because it is very resource barren. I mean, I worked in Baltimore City and you could tell anyone, just go to the clinic, just go to the clinic. And there was always a clinic you could walk into and walk out with antibiotics or something along those lines. Up here, it's so not like that. It's crazy. It's super rural.
And as far as like other services that our program could provide, it's been interesting to like see how it's evolved with participant input. As I've gone through nursing school, I've added like services and resources. So at first it was like safer use supplies, bam. Then it extended into wound care supplies. Then it extended into hygiene. Like basic hygiene has a huge impact on a whole person's health. And then learning about the benefits of protein and hydration. So we get protein snacks, like high calorie, high protein snacks, just water for hydration. Like people need to drink some water. So we also offer like safer sex supplies, pregnancy testing, to try and meet people. like they mentioned earlier, not accessing prenatal care, that's very common in Cecil County. So if we're able to connect someone with that resource and then, connect them to a provider, that's what we're trying to do. So it's whole person health, like participant-centered care, and it's continues to evolve as we learn more and see what works in practice.
So when we do care for folks, it's not really like in a hospital or like an organized system. It's like HIPAA mandated with all this stuff. Ours is more of it's a verbal agreement for us to work with them. And at that moment, it's like when I find out someone's pregnant, I'll give a phone call. Hey, look, we got a pregnant girl. It's not getting any prenatal care. And like, what do we do? Because I know I can't do it. I know it's way out of my scope, and it's knowing where my boundaries are. But I don't have to maintain that level of, it's not like, it's a level of confidentiality that you can't do in a hospital or organized system. We can flow downstream. I know it can't flow upstream. And it's like, we're the outside arm for a lot of these services that we can go deeper into situations like where people are hiding and whatnot. Yeah.
I think for like the linkage to care part, again, the best, not the only thing, but one of the best things I can offer is my experience. And through Voices of Hope, they linked up with Johns Hopkins, and I was able to get tested for hepatitis. I was positive. I was able to get linked to treatment. Even in recovery, things need to be simple for me because I'm not going to follow through. I think one of the presenters said that last test, I've been cured for like almost a year, and I just got the last test done because I'm not used to following through with things. But I did, and I'm cured, and I was able to do that pretty simply through Voices of Hope and Johns Hopkins. Yes.
Well, perfect timing. It's 1:45, so before we shut down, is there
Any last 5-second thing anybody wants to say that needs to be said other than here's one?
No, I mean, I just think that it works. Health departments, community-based organizations, the relationships. So if you have a community-based organization in your county, please feel free to reach out to us. I'm sure Katie and myself, we would give you insight, guide you through the process if you had any questions, because it does work. It does work for the best for the community.
And I'll just say our collaboration, our partnership is a model that's trying to expand across the state because it makes sense and it works. So advocate, do what you need to do in your organizations to make it work. Like working together makes everything easier. So why wouldn't we do it? It makes sense.
I'm just gonna throw my 2 cents about the peers. You need to have peers. If you guys are doing this right, like a nurse and a peer, the nurse has that background knowledge that you shouldn't expect everybody else to have, and the peer keeps you grounded, but they got to get paid more to make sense of it.
Well, thank you, everyone. And thank you.